Assalamualaikum warahmatullahi wabarakatuh. Delil Khairat from Kuala Lumpur. Apa kabar sahabat di Khairat TV? I hope you all safe and healthy. We have something special for you today. In this edition of ONlinE, Obrolan Lintas Negara, I was talking to Dr. Jeffrey Chow, a very good friend of mine who has been studying and working in the US for over 25 years. Jeffrey, he's currently an assistant professor at Buffalo State College. He lives in Buffalo, the state of New York, with his wife Kathy, who is a nurse, by the way, and their two sons, Dylan, 5 years old, and Ethan's getting to 3 years. Jeffrey, who's from Bangsa, Kuala Lumpur, Malaysia, is very kind to share his views on how the US is coping with the COVID-19 and how this pandemic is affecting their life. I hope you enjoy this interview and find it insightful. Stay safe, everyone. Wassalamualaikum warahmatullahi wabarakatuh. Jeffrey Chow, thank you for agreeing, sharing your experience during COVID-19 in the US for the Khairat TV YouTube channel. My first question will be how you summarize the development of COVID-19 in the US so far.
Okay, so thank you, Chikara, for having me on here and allowing me to share my views. I just want to state that all my views are my personal views, and it doesn't represent my workplace or anyone else.
Cool.
So let's begin, right? So I think your first question is how has the COVID-19 or the coronavirus experience been for us or me personally?
Yeah.
So so I live in Buffalo, New York. I first need to make something clear because when people think of New York, they think of New York City.
Okay.
But I live in Buffalo, New York, which is closer towards Niagara Falls. In fact, I am closer towards Toronto than I am
Okay.
to New York City, right? So when people talk about New York, they always think that we all live in New
Manhattan.
York City, yeah, Manhattan and all that. So,
Yeah.
but no, so I'm considered Western New York, the western part of New York.
Okay.
So, so just let me talk in general terms about the experiences in the United States first,
Yeah.
and then I'll talk a little about New York City, and then I'll
Okay.
talk a little about Buffalo, New York.
Please.
So, as you know, this virus is very new,
Of course.
and it, you know, I'm not sure the origins of the virus. I mean, it's still up to debate, right? Whether it came from China or whatever the case is. But I'll let the experts figure out how it transmitted and how it came about to the United States. Um, so we in the United States were very, very unprepared for this pandemic.
Okay.
That is very clear. For the amount of deaths that we have, I mean, it's really shameful that you know so many people died. We had warning signs. The lights were flashing that the virus was going to come to the United States.
Yeah.
Unfortunately, things were not put in place to help prevent the virus from spreading so much around the U.S. Right?
Yeah.
We were really unprepared. I mean, it was such a sudden shock to the system because you know in March we kind of knew in January, February there was something going on, and then in March it just came to us like a freight train, right?
Yeah.
You know, all of us were yanked out of work. The kids were pulled out of schools. Basically, there was a complete halt to people's lives. You know, their social lives, their work lives, their you know personal lives. Everything just came to a halt. I mean, it was just sudden. I mean, it's not a feeling that you can explain because it's so bizarre. I mean, you just go outside and you just see everything's empty.
Yeah.
You know, you can actually hear yourself think,
Yeah.
right? And all the noises that you're so accustomed to it's not there. So there's something wrong, right? I mean, it seems peaceful outside, but there's something terribly wrong. Yeah, so we were very unprepared when the first wave came in, right? I think there was a rush for groceries, a rush
Mm.
for medication, hydrochloroquine, whatever they call it, right?
Yeah, yeah.
Hydroxychloroquine. There was a rush for toilet paper.
Yeah.
Yeah, there was kind of a big thing here. And then the hospitals were overwhelmed. The
Okay.
hospitals were overwhelmed very quickly. I
Mm.
think one of the hardest part was the unemployment. A lot of people lost their jobs. I
Of
mean,
course.
it was brutal, right?
Yeah.
March. And don't forget, in March we were still in that wintry season. I mean, it was still cold. I mean,
Yeah.
it's not it's still you know you could go out and have fun and all that, but it was still cold and miserable. So it just added to that whole feeling of hopelessness, I guess.
Mm. Mm.
And
Yeah.
so, yeah, so yeah, we were not prepared then. We are certainly not prepared today.
Okay. Okay.
Okay, okay. So let me just talk a little about New York City, right? So New York City was hit very, very hard
Mm-hmm.
simply because that New York City is the gateway to the United States, right?
Yeah. Yeah.
Yeah. So with New York, it has three large airports, right? You
Mm.
have LaGuardia Airport, JFK, and I shouldn't say New York, New Jersey, and Newark Airport also. So those three airports
Yeah.
service the New York area, and you have people from all around the world, from China, from Europe.
Mm.
So like I said, they don't know whether the virus came from China directly to the United States, or it went from China to Europe and Europe to US, right?
Yeah.
So let's let them figure it out. But my main point is we were the gateway to the United States. So we have people from all around the world coming into the United States,
Yeah.
and then that's when the epidemic started, right? I think the New York State government didn't really understand, or not. I shouldn't say they didn't really understand, but they didn't really comprehend
Okay.
didn't understand the magnitude of how this virus was so dangerous, right?
Yeah. Yeah.
Right. So I guess when all the cases started going up, and
Mm.
more people were going to the hospital, and it stressed the hospital system out, and they knew they had a problem, and that's why Governor Cuomo, whom I think did a phenomenal job
Mm.
in helping flatten this curve, right?
Yeah.
I think he did really, really well flattening the curve, right? And in making sure that the cases that didn't go up as high as 100,000. I think in I'm not sure what the cases was in New York. It might be about 80 or 90 or 100,000 or
Oh, I think
close to that.
more
I
than
can't I
that.
can't
Yeah.
remember
Yeah.
because so many
More than that.
statistics.
Yeah. Too
No,
many
just in New
statistics.
York. New York.
Yeah.
Is it? Yeah.
Uh.
I'm not sure.
Oh.
At some point, I just tuned out all the COVID-19 news because it just keeps on. You keep hearing about it all the time, and you kind of tune it out, right?
Yeah.
So, so that was the New York City experience. In fact, I had an Indonesian friend that lived in New York City,
Okay.
and
Yeah.
then when the virus became so bad, he traveled to Buffalo.
Buffalo.
So
Okay.
he's in Buffalo. So the experience in Buffalo is a little different. I mean, we had cases. I don't think we went over 6,000 cases, but
Yeah.
still 6,000 is a lot, and we still had a lot of deaths.
Yeah.
So we were a little better. We were a little better because in Buffalo, New York, we have the the there's a little more land, right? There's a little
Yeah.
more space around us, so we are able to social distance better than the New York City folks, right? New York City, it's very dense.
Yeah.
You have a lot of close proximity, right? In Buffalo, New York, we're able to social distance better
Okay.
than in New York City.
Yeah. Yeah.
So I also have to say the people in I think in New York for a fact I think we were a little more disciplined when wearing
Okay.
masks.
All right.
You know the so I think we were better in that. When just going to the stores, you see a lot of people wearing masks.
Yeah.
So that helped. I think we still wear masks. I mean, out of the uh, 10 people that you run into the store,
Mm.
at least 9 of them would have a mask, right?
Good. 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 Yeah.
You
Yeah.
always have one individual who
Of
will
course.
always
Yes.
uh, buckle the system, right? So
Yeah. So
go
you
ahead. You
cons
have any questions for me?
yeah, you consider then the New York State is quite successful in fighting the coronavirus if you compare to other part of the US?
E- Um, uh, we it's hard for me to answer the question now
Mm.
because we have a pandemic that's going on in Texas,
Okay.
Arizona,
All right.
and Florida.
Yeah.
So when New York City when New York State was having its own pandemic, the other states were not as bad,
Okay.
but now it's kind of reversed. So New York State is now um, it's actually we have flattened the curve,
Yeah.
but then you have Florida, Arizona, Texas. The cases are awful. Uh, I think it was 2 days ago we had 50,000 reported cases in a single day. That broke a record
Wow. Okay.
in the
Wow.
U.S. Right,
In the
fifty
US.
thousand, right?
Yeah.
So,
Yeah.
but
Yeah.
for New York State, the governor and I mean the rest of the government machine, they all came together and said, hey, you know what? We are going to follow what the health expert says.
Okay.
Wear masks. So all of us wore masks.
Correct.
Social distance. Wash your hands. We wash our hands, right?
Okay. Okay.
When you sneeze
Yeah.
into your elbow, right? The
Yeah.
crease of your elbow, or even if you cough, just cough into your arms, whatever the
Yeah.
case is,
Yeah.
right?
Yeah.
So
Yeah.
so
Good.
that's the thing. So for me to answer that, if we are we more successful, that question will be answered in about a month or two, right?
Okay. Okay.
Once once this case is in Florida
Texas.
and Texas and
Yeah.
even in California, right? I mean, in Arizona, it's really awful. It's
Mm.
really
At the
awful. I
moment.
feel bad
Okay. Yeah.
because because not only does it put stress on the health system,
Yeah.
but the nurses, right? The nurses, the doctors. My wife is a nurse, so
Okay.
the amount of pressure that they go through, right? Working
Yes.
12-hour shifts. Most doctors and nurses here work 12-hour shifts. When you work 12-hour shifts, you have to wear a mask. That takes
Yeah.
a lot of,
Yeah.
and
Yeah.
it was described to me by I can't remember who, but you know, some of the patients were coughing up
Okay. Yeah.
pink
Yeah.
fluid, right? So
Yeah. Exactly.
yeah,
Yeah.
it's awful, right? Because it's a
Yeah.
pneumonia, it's a lung virus, right?
Yeah. Droplets, they call it. Yeah.
Yeah, droplets, right? So
Yeah. 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 Jeff, so you consider people in the US actually, at least in the New York State, are disciplined enough actually of following the procedure or SOP, everything?
yes, for the most part, I think New Yorkers are a little more. Um, I would don't want to say the word obedient, but I think it's proper. They're a little more obedient when it comes to wearing masks and following
Okay.
procedures. I think for the most part, yes, we are
Yeah.
a little more obedient when it comes to following
Yeah.
the medical advice
Yeah. I'm sure that that help,
yeah,
of course,
right.
to a certain extent in flattening the curve.
Oh
Um,
yeah, yeah, yeah.
yeah.
I mean, you see the results, right? I mean,
Yeah,
this
yeah,
results. I mean, if the people didn't do their parts, then you're going to have a lot of cases. So we managed to flatten the curve here, so
yeah, yeah.
which is good. Not to say that there's not cases cropping up here and there. There are cases cropping up here and there, but at least it's at a manageable level, right? You do not want to get it to a pandemic level.
No,
Right
no.
now, it's just you if you have clusters, then that's fine. You just identify the clusters. But when it becomes a pandemic, when it spreads in a huge population, that's when you have a lot of problem, right?
Sure, sure. Now let's move on to how this COVID-19 affect your life, Jeff, your work and your family life.
Oh yeah, I mean, so work life, yeah, I mean, yeah, certainly as a professor, right?
Yeah,
Certainly, my interactions with students have more or less been online,
online.
which is, yeah, which is, okay. But I think, there, it's really different when you talk to people online and when you talk to them in person, right? At least you have
Yeah,
that emotional connection or
yeah,
that personal touch, right?
yeah,
So yeah, I mean, it's kind of weird not being able to go to work. When you go to the office, you kind of zone out. This is my space. This is what I do. You do not get distracted.
no,
I'm in my basement in my office right now, and while I'm working, and then I have my son. I'll just turn the computer around a little.
sure.
Um, drum set.
Wow, wow.
Yeah,
Cool.
that's a baby drum set, right? Well, it's
Yeah.
cool, it's nice, but when you try to work, or even when you try to do an interview and you start banging, right? In
Yeah,
fact, this office, I gotta say that I'm actually doing some work now that
yeah,
I'm off, kind of off. I'm able
yeah,
to do some work. I'm actually remodeling my office. So
yeah.
yeah, it's been difficult in a sense, but you know what? I get to spend more time with my kids, which is
That's good.
awesome.
That's
Actually,
good.
be
Yeah.
it's kind of to see my son, who my youngest, who is um, he's 2.5, coming up to 3.
Okay.
You could see him develop,
Yeah.
cognitively,
Yeah.
his speech getting
Yeah.
better. So it's nice and it's fun.
How many
Yeah,
kids you have,
uh,
Jeff?
I've had 2,
Oh, two.
Dylan
Okay.
and Aiden.
Okay.
Dylan is 5, Aiden is 3. Going to be 3. So yeah.
Right.
Well, one thing it's difficult for me also is that they have friends,
Yeah.
they have a social group that
Hmm.
they hang out with.
Of course.
So when we had to pull them out from school, it disrupted their social lives.
Yes.
For adults, it's fine.
Yeah.
We understand what's going on, but for young children, it's hard. But it's
Yeah.
interesting. I mean, both my boys are pretty sharp. You know,
Okay.
they understand that when they go out, they have to wear masks, and when you
Mm.
ask them why they have to wear masks, they
Yeah.
say, "Oh, because there's a virus, and the virus is bad, and we can get sick, right?"
Yeah. Yeah.
So, I mean, how
Yeah.
much can you expect from a 5-year-old and a 3-year-old?
Understand.
They're
Yeah.
very,
Yeah.
they're very good. Yeah, and they're very good at wearing masks. They are
Yeah.
very, very good at wearing masks. They don't give us any problems at all. So yeah,
Yeah.
it affected my kids. And then um, and then one of the things is, when you're at home, I love to cook,
Okay. Good.
and I've been cooking a lot. You're cooking satay, rendang, chicken curry, so you tend to eat a little more stuff that you don't normally eat.
Yeah.
So your throat becomes a little buncit, right? Yeah, so that
I
becomes
can
problematic,
imagine.
right?
I can
Yeah.
imagine. Yeah.
So,
I was
so
helped a bit by Ramadan actually, Jeff. So
oh, you were
I can keep up my shape a bit because during
okay.
Ramadan, of course, you are forced to
Yeah,
discipline in your diet, right? But after
right,
Ramadan,
right.
I'm not sure. Let's see.
Let's see, right? Yeah.
Yeah.
So I mean, overall, I mean, just the usual stuff, being able to hang out with friends, and the normal stuff, right?
Yeah.
It's like it feels so different because you have a routine that you go through every day or on a weekly
Yeah,
basis or whatever,
yeah,
it has been disrupted by the virus. Every time you want to do something, you have to think twice. Can I do this? Should I do this? Right.
yeah, yeah. So do they
So
back to school now, Dylan and Ethan?
Dylan and Aiden, so there has not been a decision on whether
Okay.
schools are going to be
Oh,
going to
okay.
open.
Mm,
The problem is you have a classroom that has say 25 to 30 students,
mm,
right?
yeah,
And that's in that classroom is compact, right? It's not a small classroom, but it's a classroom
yeah,
that's filled.
yep,
You
yep.
cannot have that for COVID-19, right? You
No,
have to
no.
social distance. So
Yeah,
the maximum you could have is maybe 10 kids.
exactly.
And do you think a 5-year-old
You can
with
control
social
them.
distance? Yeah.
Yeah, yeah, yeah.
Do
Okay.
you think do you think he's gonna sit down and by himself and not mingle?
Yeah, yeah, definitely, definitely.
So it's going to be an issue, I think, for many parents in the United States because because if we cannot send our kids to school,
Hmm.
then one of the parents have to stop working,
Okay.
right?
Yeah.
Which is exactly what happened with me and my wife, right, Patty?
Okay.
So she had to stop work because
Okay.
I had been working, right?
Okay.
And so she had to stop work to look after the kids because if she didn't look after kids, I could not work and we would be in a lot of trouble.
Oh, okay. Okay.
Yeah.
Okay. She's
So
not
I mean,
working now. Okay.
no, she went back to work.
Okay.
She
Okay.
just she just went back to work. But I mean, it was for all of us. My fam and my friends, it's usually the wives that end up stopping, having to stop work
Yeah.
to look at the kids, right? I mean, you
Okay.
can have a 3 or 5-year-old or 6-year-old or 2-year-old, whatever, to look after themselves. I mean, it'd be
Yeah. Yeah.
nice, but that won't happen, right?
Yeah.
So it is going to be a problem for fall. I'm
Hmm.
not sure what they are going to do.
Yeah.
I'm not. The whole thing is everything. Everything is going to be on a holding pattern
Hmm.
until they find a vaccine
Yep.
or a uh, I'm not going to say cure, but some kind of good therapeutic treatment, right?
Yeah.
I know
Yeah.
they have remdesivir right now. By the way, United States bought up all the remdesivir supply in the world, right? I don't know if
Yeah.
you knew that.
No. No.
Yeah,
No.
it was in the papers, right? So the United States completely bought up the supply. So if you're not in the United States, chances are is you're gonna have to wait for a while to get the supply.
Okay,
Yeah,
okay, makes sense. I mean, it
yeah,
makes sense.
yeah.
So now,
Yeah.
since Kathy now back to work, do you need to kind of, do something special at home? Consider she's a nurse, and then she may be exposed to the virus more than others.
Oh yeah, well, yeah. So she is what they call an IV nurse,
Okay.
intravenous nurse,
Yeah.
and intravenous nurse usually end up seeing very sick patients that have cancer,
All right.
patients that have autoimmune disease,
Disease.
and
Okay.
other kinds of serious illness. These people
All right.
are very cautious but themselves because they cannot catch COVID. If they
Of
catch
course.
COVID, they
Yeah.
themselves will die, right?
Yeah. Yeah. Yeah.
So, so my wife's exposure to them is actually to COVID is actually lower
Lower.
because
Ah.
these
Okay.
people they actually take more precaution,
Yep. Yep.
right, than normal folks, right?
Yeah.
If you're healthy and whatever and young, whatever, you're like I
Yeah.
probably could beat this, right? But if
Yeah.
you have cancer and then you're
Yeah.
thinking, okay, you know what? Maybe I'm not going to go shopping. Maybe I'll let someone else go.
Yeah.
Maybe I'll wash my hands more often than other people do.
Yeah.
So the risk exposure. I mean, you're in the insurance business, so you understand risk, right? The risk
Yeah.
exposure is, if you compare it to like someone like me, going
Yeah.
to teach in class, the
Yeah.
risk exposure is actually higher, right?
Higher. Yeah. Yeah.
Yeah,
Exactly.
simply because the kids, they are young, they don't social distance.
Yes.
So yes.
Okay. Good. 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 That's good to hear. All right. So if you see now where the U.S. now stands for the COVID-19, right? So to
Right.
see the current the recent trajectory, are you positive about the development? I mean, you believe that U.S. will manage to flatten the curve even further, and then things will get improved? You
Um,
no, this is your personal
so
opinion, no? Right?
yeah. My personal opinion is that that okay. My personal opinion is that the United States will suffer a significant amount of COVID deaths
Okay.
in the next few months. We do not have a unified voice
Yeah.
of not only unified voice, but also a rational voice
Okay.
that's
Okay.
coming up from our leaders, right? To
Yeah.
say, hey, wear a mask, social distance,
Yeah.
stay at home if you can, right? We
Yeah.
don't
Yeah.
have that. I mean, we have that in individual states, but
Yeah.
we do not have it as a
A national
country. We do not,
countries.
yeah, as a nation, we do not have that as a nation, right?
Okay.
I think
Okay.
that's where leadership is so important, right? When you have the
Yeah.
strong leaders to say, hey, you know what, this is what we have to do in order to flatten the curve,
Yeah.
um, to prevent the spread of the disease. Just look at that CNN, look at all the other news. You can see people partying by the
Yeah.
poolside, right? In
Yeah.
a beach. Fine. I mean, yes, constitutional rights. Yes, you have all the constitutional rights to do what you want, but
Yeah.
then also understand that when you exercise those rights, it affects other people, right?
Yes, definitely, definitely. Well, we understand that the every states in the U.S. has their own authority, independence
Right. Yeah.
to make decision, right? So this for the
Right.
good and for the bad of the COVID-19 fighting
Right.
actually, right?
Right.
Depending
Right.
on your leaders in each state.
Right.
I managed to see the latest statistic actually of US COVID-19, Jeff, before
Yeah.
our discussion. So at the moment, US is actually approaching 3 million infected cases. 2
3 million.
million,
Oh,
yeah,
okay. Yeah.
almost 3 million, 2,934,000, and the deaths is actually 130,000. That's equal
Yeah.
to 4.4% of fatality rate. Slightly better than global stat anyway,
Yeah.
because
Yeah.
global stat is about 4.6%. Yeah,
Yeah. But
but
still, we talk about percentages, but these percentages are humans, right?
yep, exactly. Yeah,
Fathers,
yeah,
mothers,
yeah,
children.
yeah, yeah,
So every death that occurs, I mean, it's awful.
yeah. But
Yeah.
one the interesting thing about U.S. stat on COVID is that U.S. so far has tested COVID for 36 million people nationwide. This
Yeah.
based on the John Hopkins University website.
Yeah.
So that means if you start from January, I mean
Yeah.
that means at least you do testing for like 200,000 a day. That is massive. Have you tested as well, Jeff?
No, I haven't tested. I'm not sure how accurate that
Mm.
statistic is. Eh? Where did you get that statistic from?
This from the John Hopkins
Hopkins.
University.
Okay.
Yeah,
Yeah, yeah. I mean, they are definitely a reputable university.
yeah.
The reason why I asked is
Mm.
because when they first said you can go get tested,
Yep.
very difficult.
Okay.
There was long lines, and then you have false negatives or
All right.
false positives.
Yeah.
But even the test, what kind of test do you take? Do you do the nasal swab test?
All right.
you do the blood
The,
test.
yeah.
Yeah, so there was so many confusions even today
Mm,
to get tested. I mean, it was at a point, right? You, in order to get tested, you had to call your doctor,
yeah.
tell your doctor the symptoms. He will write a script, and
Yeah.
then you take a script to a drive-through, which
Yeah.
is probably like driving to KL during traffic during 1 o'clock, when everyone wants to go for it, right?
Yeah. Yeah.
Yeah. So it was very difficult, and maybe yes, maybe the testing has gotten better. Like I said, I've tuned out a lot of the noise because at some point when you hear negative news, the amount of deaths, I mean, it gets very depressing, right?
Yeah.
So the only news that I really listen to now is about the the kind of treatments that are coming out, and also the vaccines, right? That's the
Okay.
only
Yeah.
really thing that I kind of pay attention to. But
Yeah.
yeah, to answer your question, yeah, I mean the testing, you know, if you want to test right now, you could get it, but
Yeah.
they don't make it easy for you,
Okay.
right?
Okay. Okay.
Right.
Oh, but
Unless you really, really
really
have uh, some really bad symptoms,
symptom.
and you're
Yeah.
like gonna do mati, like go mati, right? Then yes, yeah, we'll test you, right? Right.
Jeff, listening your story, right? I'm feel very lucky, live in your country, Malaysia.
Yeah, yeah, yeah. I mean, I was talking to my dad. I think the MCO, right? They call it MCO.
We call it MCO in English or PKP in Malay.
Uh,
Perintah Kawalan Pergerakan. Yeah.
will never happen in the United States. Yeah, the MCO,
Yeah.
the MCO essentially takes your right away, right?
Oh yes, definitely. Yeah.
Takes your rights away for you to go anywhere,
Yeah.
right?
Yeah.
The
Yeah.
United States, oh no, you got
Okay.
all your amendment rights, right?
Human
So
right, all the stuff.
yeah, they call
Okay.
it constitutional rights, right?
Yeah, yeah. Well, I have to admit that Malaysia is doing very well.
Yeah, yeah.
Now the new cases is running on single digits below 10.
All right, okay.
And then about 94% infected cases recovered already.
Yeah,
And the death fatality rate is 1.4% only. All right.
okay,
So I
that's
think
not too bad.
in last 2 weeks, no new deaths. So,
Yeah,
and I think only in last 2 weeks, only 4 people in the ICU.
okay.
So I mean,
Yeah.
you can imagine that the healthcare system no longer under pressure at the moment in Malaysia.
Oh yeah. I mean,
Yeah,
it was the healthcare pressure. It was awful. I mean,
yeah.
it was awful. What about Indonesia? How has
So Indonesia is slightly different. Well, not slight actually. I think it's comparable to the US, I believe, because Indonesia also a big countries, and
yeah,
the political system also very much similar to US, where each province will have their own authority,
oh yeah,
and then so you have mixed development now between province. Some province did very well, managed to keep flatten the curve very well, but
yeah,
certain province, especially capital Jakarta and Surabaya, they are struggling because again, like New York City as well, they are
yeah.
the gate for Indonesia, right? So people from all
Right.
over the world also come to Indonesia
Yeah.
from their places. And yeah, I think I found a very similar situation in Indonesia as well when it's come to the political issues and how the leaders comprehend and understand the case, the COVID-19. Yeah.
Right. I mean, in Indonesia's case, I mean, I think it will be even worse because I don't think the healthcare system is
Yeah,
as
you're right. I mean,
good as
there's you're right, worrisome actually, because statistically, even before pandemic, right, the Indonesian healthcare statistic is like behind even the neighbor countries actually. Singapore, Malaysia, of course, leading in the region. But
you're talking about mortality.
no, no, no. The healthcare
Oh, the healthcare
facility,
system.
the healthcare
Oh,
system.
okay.
a
Right.
number of bed per thousand people, for example, Indonesia very much lacking, right? So
Right.
when once the COVID-19 hits, then you can imagine immediately the system under pressure. And this is, you can see from the statistics of how many doctors and paramedics died during the fight
Okay.
against COVID-19. Is staggering numbers. I mean, now probably close to 100 doctors died
Yeah.
already across nations. So I think this is the highest number in the region. We are on the top of the chart now for the ASEAN countries in terms
Yeah.
of deaths, in terms of the confirmed cases as well.
Yeah. You know, this is why you need to have good governance, right?
Yeah, exactly.
Yeah, good governance, and like the case in Singapore. I mean, um, you see, in Singapore, they did well with controlling, but
Yeah,
unfortunately, they did not pay attention to the clusters. There's the migrant workers, right?
correct. Yeah,
Yes, they didn't pay attention to the migrant workers. In this kind of case, in this kind of pandemic, doesn't matter whether you are professor, doctor,
yeah.
or homo or whatever. You will if you get exposed to it, you will get sick.
You
I
get
mean,
sick.
it's no doubt about it, right?
No doubt,
You get
no
sick, right?
doubt. Yeah,
How sick you get is going to be,
yeah,
it's
yeah.
depend on your
Uh,
luck. Yeah.
those migrant workers also a problematic issue in Malaysia, and
Oh yeah.
I believe probably more problematic in Malaysia than Singapore, because in Singapore they are more concentrated where they
Right.
are. I mean, the facility they just stay there. But
Yeah.
in Malaysia, you have like, I don't know, maybe 3 million migrant workers in the country
Yeah.
out of 30 million population.
Yeah.
And the migrant workers in Malaysia mingle around with the public, right? So,
Right.
and the things make a bit worse is that the fact that many of them also illegal workers.
Right. Right.
And the things with the illegal workers, that it's not easy to identify them,
Right.
and maybe your statistics are not correct, right? So it's
Right.
difficult to control. Yeah.
It's a similar situation here because
Mm,
we do have a large, not large, but a significant uh, illegal immigrant population in the United States, right?
okay, okay.
Yeah, we do because you have undocumented people from different parts of the world,
Yep.
from Mexico, from Europe,
Okay.
from Asia. These
Yeah.
are the people that are not going to identify themselves,
Yeah.
uh, especially during. I mean, in this administration, because if you're illegal, then you are going to be deported, right? So
Yeah.
these people, they get sick, they don't say anything, they try to recuperate at home or
Yeah.
whatever the case is. So, but then they end up spreading stuff to people, right? So
Yep.
the issue here, I'll say this real quick. So the illegal immigrants, they don't get any kind of benefits, right?
Yep. No.
They don't get any kind of relief payments. So if they get sick, guess what they have to do? They
Correct.
have to go to work,
Correct.
right? They
Yeah.
have to go to work at wherever they work. They'll infect other people, right?
Yeah. Yeah.
So I mean, it's unfortunate. I mean, this is how things are, right?
Yep. Yep.
Yeah, I mean, if yeah, I understand immigration is an issue, right? But again, when it comes to health, decisions have to be made based on statistics, research,
Exactly.
uh, and just making smart choices, smart
Correct.
decisions, right? You
Correct.
cannot politicize everything, right?
Yeah.
Yeah.
Jeff, we have been talking more than 30 minutes actually, Jeff.
Okay.
Time
Sure.
flies. And well, it's very interesting discussion, to be honest. And
Yeah.
maybe people who listen or see us in this discussion may think that we've been knowing each other for more than 20, 30 years, but in fact, we
Oh no.
never properly physically met.
Yeah. Yeah. You're so nice enough to help me with my paper. By the way, my paper got accepted for publication.
Cool.
So your name is in there as an acknowledgement for helping us out. So once it comes out, you can take a look at it
Cool,
and
cool.
see what you think. So, but yeah, I mean, it's been awesome. You've been helping me for so many years.
No,
I'm very
no problem.
thankful.
Let me know. That's my passion as well. So anything I can do for your research, your paper, let me know.
Awesome. If
Yeah.
you live in Ampang, eh? Where do you?
I live in Wangsa Maju.
Wangsa Maju.
Yeah,
Okay,
yeah,
Wangsa Maju.
yeah. Wangsa
Yeah,
Maju. Yeah, near
but
Ampang.
if I come to KL, I live in Bangsa, so you probably know where Bangsa is.
Sure. Let me
Uh,
know. Then we catch up for over tea tarik.
Teh tarik and you know,
Wha-
what I want to eat that I haven't had is mi bandung, eh?
Okay. Well, that's interesting. Me Bandung that you cannot find in Bandung.
Yeah, mi bandung, right?
Yeah,
They
yeah.
make the mi bandung with tomato sauce in KL in
Okay.
Bangsa. So
Okay.
it sweeten the sauce. I mean, it's a lot of stuff, right? You see,
Yeah.
when you live in Malaysia, you get to enjoy food from
Of
Indonesia,
course.
Thailand,
Of course.
Philippines here. Yes. So
Yeah, yeah.
here's the
Okay, okay, Jeff, before we
yeah,
close this session,
yeah.
anything a closing remark for you, or maybe for people
Oh,
in
sure.
other part of
Yeah.
the world? Yeah.
Yeah. I just want to share with people that yeah, the pandemic here is it's pretty bad right now.
Mm,
But it's geographical, right?
yep.
So uh, in New York we had our pandemic, and now it's gone to the other states. But I think overall we will survive this, right?
Okay.
Absolutely. You know, this is not dark ages where there's there's no cure. We have a lot of brilliant minds. In fact, that's one of the things I wanted to say, that um, with all the chaos that we have in the United States, there are a lot of good people.
Okay.
A lot of good people. There's a lot of smart people. There are a lot of people that care.
Yeah.
That's going to help us get through this, right?
Very good.
So we will be fine.
We will be fine, and
Yeah,
the entire world will be fine as well.
yeah. And then
Yeah.
you can come and visit us at Buffalo. I'll take you to Niagara Falls.
Definitely, inshallah, we call it.
Okay.
Jeffrey Chow, thank you very much for your
You're
time.
welcome.
Really appreciate that really interesting discussion chat we have, and I'm sure this will be very useful for all our friends out there that also
Okay.
facing now the same issue of pandemic of
Okay.
COVID-19. Thank you, Jeff. Take care
Thank
there.
you. All right. Bye
Thank you.
bye.
Bye.